Our disability is our greatest strength. It gives us the supervision to see the issues facing humanity from a more inclusive perspective and the grit to fight back against all odds. Welcome to Super Adaptables, the More Than Walking Video podcast discussion. Welcome to Super Adaptables, the podcast where people of all abilities gather to discuss pressing issues that affect the disability community and their implications for the world at large. We're your host. I'm Corey Pheez, C4 complete quadriplegic since 2005.
And I'm Jonathan Sigworth, C7 complete quadriplegic since 2006, both of us hailing from the great state of Connecticut.
Indeed, and we are recording this on Thursday, the 6th of March, 2025. And in a little bit, we'll be discussing Medicaid, healthcare for the disabled and most vulnerable.
A really important and timely topic. And before we dive in, Corey, I first wanted to share that we are so thrilled that this year Super Adaptables is made possible in part by a generous grant from the Christopher and Dana Reeve Foundation's National Paralysis Resource Center. The information provided and opinions expressed in these podcasts do not necessarily reflect the views of the Christopher and Dana Reeve Foundation. For more information about the Foundation's National Paralysis Resource Center, which is amazing, visit www.christopherreeve.org. Also, I should note that the views expressed on this podcast do not necessarily reflect those of More Than Walking either, but belong to us as individual speakers ourselves.
But, getting back into the topic again. I was doing some research, and the English critic, essayist, and poet Lee Hunt once said, "The groundwork for all happiness is health." So, if you open up any social media application, you'll find tons of people from various age groups. Either they're working out, they're selling athletic apparel, and they're promoting overall wellness, which gives many people joy. However, health and happiness can become sullied by illness or injury, which can lead to costly medical bills.
Exactly. And while diet and exercise are recommendations that all of us should adhere to regularly, life does have its mishaps. And one way or another, you will find yourself needing some form of affordable and accessible health insurance to help curb those costs, both now and in the future. Now, Medicaid is a form of health insurance subsidized by federal and state governments for people with disabilities, limited income, and resources. It also goes by different names depending on what state you're in. As of October 2024, 72,058,701 people are enrolled in Medicaid nationally. Moreover, the harsh reality is that many vulnerable groups are dependent on the benefits that the social safety net provides, but funding for it is constantly being scrutinized, leaving its beneficiaries worried because of the uncertainties about healthcare coverage for themselves and their families.
Yeah, it's true. Programs like Medicaid, they serve about 1 in 5 Americans. That means your neighbors, family members, coworkers, if you own a business, your employees, single parents, families with low wages, church members, the elderly, and people and persons with disabilities are using this benefit. So next time when you're out in public at the mall or family gathering, you really should think twice about the various population groups who utilize this type of insurance, because it isn't just simply poor people.
Absolutely, Corey. And I think you hit the nail on the head. There are so many misconceptions associated with Medicaid that it's easy to believe that social safety nets such as these are filled with so much waste, fraud, and abuse that drastic spending cuts are the only solution for fixing issues that may be linked to any particular group. For example, according to the Kaiser Family Foundation, a nonpartisan think tank, one myth about Medicaid is that spending cost is out of control. Yes, spending has indeed increased, but it's due to more enrollees applying during economic hard times. In general, overall healthcare costs have gone up across the spectrum, not because the government is just randomly printing money.
Yeah, it's true. And I think, that's part of what, makes people vote either way. If they see that one portion of a particular program, it doesn't matter what the program is, but if it's seen like in a negative light, it pushes people to say it must be true, right? Without looking further into the issue. And I think in addition to that, another myth is that the notion that Medicaid recipients are given Cadillac insurance coverage. The truth for this is that many people who look like you and me And by that, I mean folks with disabilities. This is the only option for affordable health care insurance. Many of us are unemployed or working part-time due to our disability, which means little to no income. And what further compounds being able to purchase quality health insurance are asset limits associated with government-sponsored insurance plans, coupled with the fact that our unique needs require things like long-term care services that would make paying for these services through privatized insurance nearly impossible.
I mean, in fact, it is impossible, really, because you would have to be paying for long-term care services, caregiving out of pocket, because privatized insurance, if you need 24/7 caregiving, they don't even offer that as a benefit. It's not even an option. Through my wife's employer, I'm currently have health insurance. I'm not on Medicaid, but I may only have caregiving services in case that I'm further injured, for a certain number of days of the year, and that's it. So if all of a sudden I became, let's say I was in a car accident and I couldn't use either of my arms because I broke them, and for several months I needed caregiving, my private health insurance wouldn't cover that.
Right.
I would have to impoverish myself or get divorced in order to immediately access the benefits from Medicaid. So it really is a huge issue.
You know
And
what? Like just to piggyback what you're saying about the affordability, going back to Christopher Reeves, I don't know if you had a chance to watch his recent documentary that aired on CNN, but I remember them saying his care costs about $400,000 a year. Like, do you know how much money you have to have just in cash reserve? Is, if you're not unable to work, you have to have millions set aside to keep forking out that amount of money. And they were coming to a point where they were concerned about their insurance, right? So even the ultra wealthy has to confront this idea because anything can happen.
absolutely. And you consider waste, fraud, and abuse in Medicaid, which is constantly a refrain that we hear from critics of the program. Compare whatever numbers they come up with for that potential line item with the amount of tax evasion that is going on by the ultra wealthy and by people who make a ton of money and are not paying taxes because of existing loopholes or because IRS is not sufficiently funded and or staff is being reduced. People who will go after big tax evaders who make tons and tons and millions and billions of dollars. That is where the fraud and abuse is. It's not in the programs where, as you said, the costs are going up because more and more people who need it are enrolling.
Right.
And when you apply for these programs in a state, the income limits and asset limits are so restrictive that, as I said, people have to get divorced, people have to impoverish themselves. But even if you are eligible, figuring that out is a months-long process of just navigating the website, talking to customer service on the phone. And these systems are designed to be difficult to navigate because that's how they weed out the people supposedly who don't need it and only give it to the people who supposedly need it, when in fact there's probably many more people who need it who are not on it currently. But all aside, we can come back to it a little bit. Corey, so how did we get here? When was Medicaid established? How does it work? What department oversees it?
Right, that's a very good question. So President Lyndon B. Johnson signed the Medicare and Medicaid Act, also known as the Social Security Amendments, on June 30th of 1965. And it established Medicare, which is federally funded insurance for those who are 65 and up, as well as for some individuals who have paid into the system but have been disabled before the retirement age. People like myself. And of course, Medicaid, which is federally and state funded, aimed at ensuring low income earners will remain insured. Additionally, so when we look at these type of programs, sometimes I see like in polls they want to see how like popular these programs are, right? Some people argue, oh well, we don't want big government, or we need more government. Well, I think this speaks to the popularity of social security nets. because in the first 3 years of becoming established,
Social
20 million. Say again.
social safety nets.
Yeah, sorry, social
Yeah.
safety nets. 3 years into the program, establishment, 20 million beneficiaries enrolled. And as far as departments are concerned, the Centers for Medicare and Medicaid oversee its functions, which is an agency within the Department of Health and Human Services. And I would add one more tidbit to it. The argument for the need for social safety nets, like Medicare and Medicaid and just other social safety nets, it didn't just begin like all of a sudden with Lyndon B. Johnson. It happened, I think, 40 years before that under President Truman. And so at the time when the act was signed into law, Lyndon B. Johnson invited President Truman and his wife to like a certain location. I think it was like a library, where they signed it into law. So it was already a problem that people were looking forward to, because you have people coming back from the war, you have people becoming older, they're losing income, and they're losing the ability to keep themselves insured as far as healthcare is concerned.
Absolutely. And as we mentioned in previous podcast episodes on Veterans Administration, the VA doesn't cover benefits for non-service related injuries. So you may be on VA benefits and Medicaid.
Exactly, that's true. Yeah, I mean, I was told um, by my social worker. He said, it's great, you are service connected, but you should think about additional insurance. And so I applied for TRICARE, and I have Medicare as well. So it's almost like threefold, in order that if I'm out in the community and I need to go to a walk-in clinic, I have two forms of insurance to deal with that. And if I need to go to the ER, I can just, take that drive down to West Haven. So it's important, but it's sad that because everybody just does not have that option.
Yeah, absolutely. And speaking of health and human services, in an article written by USA Today, by USA Today, I don't know when this was, thousands of people were laid off, albeit those individuals were in a probationary period, and 700 people from the Center of Disease Control and Prevention were let go. I can't help but wonder what the effects could mean to Medicare and Medicaid recipients in the future with so many cuts in the federal workforce. Not to mention those same federal workers may need to enroll in other social safety nets, including Medicaid, if they are unable to obtain quality health insurance through another employer. Massive layoffs in any situation without prior notice is really disruptive. And it's true, Corey, I have not heard much discussion on healthcare related issues related to access to employment, where your insurance is tied to your employment. So what happens to these federal workers?
Yeah, I think about that. And that article actually was written March 1st. So it's very relevant, right? It's just last week. But yeah, I think about that, and later on down the line, we're going to end up talking about employment and unemployment. But, when you have individuals who come to work, right, and they're insured, and they feel great because now their family is insured as well. And these are like young folks too, right? Like if you're in a probationary period, you could just be fresh out of college, and just within your first 6 months or 7 months, you could have young children, and they're benefiting from that employer-based insurance. And next thing you know, you lose your job. So not only is unemployment going to have to go up, but then now, what if your daughter breaks their leg playing at school? I know my kids get injured all the time. I get a call from the nurse's office like, hey, just last week, my son jammed his thumb, right? Like, imagine if I didn't have any form of insurance to be able to take care of him because I just recently lost my job, right? So it's like, what happens to those people? And I don't think, like you said, we haven't dove more into the ramifications, because more layoffs are coming. In fact, going back to veterans benefits, I saw something the other day that they said they're going to lay off another 70,000 people in the Department of Veterans Affairs. So it's like it's coming. It's a snowball effect.
Yeah. And there's the biggest myth, I think, in all of this is whenever you hear proponents for big business say, we need to make things more efficient. There are ways to go about that include, advances in technology, reworking systems, restructuring systems that are all really good and effective. Unfortunately, the way things that are going about in the government today with just massive slashing, laying off, layoffs, that appear to not be well planned. There's not advance notice. There's reversals of some of these layoffs in certain instances. In general, the cutting of staff to make a business more efficient does not result in a better product. I mean, just look at the wheelchair repair industry, which we have a public hearing today, Thursday, March 6th, on strengthening the law in Connecticut.
Yeah.
But this is an industry that is owned by two is owned by private equity firms that control the two massive national companies,
Yeah.
and they have bought up other local, wheelchair service vendors
Yeah.
to duopolize the industry, and at the same time cutting the staff, not hiring more staff, even as they expand their operations across all 50 states.
Right.
And you see that in nursing homes and in hospitals that are owned by private equity as well, where you expand the footprint and you reduce the staff levels to make things more efficient. What that means is to make more money, to make more profit on the margins. And it just leads to worse care, less time that providers have to service repairs, to provide health care, and mistakes get made. And those mistakes can end up being and have ended up being deadly in many cases.
Yeah.
So
And
it's
then yeah, it's horrible. And then even to like incentivize people, right? Like we'll buy you out. If you have the money to buy people out, just expand your business. Or if you're gonna, instead of buying them out, have them work for you now. Like don't buy them out and give them kind of like a severance package of sorts. And now they go on to doing something else. They may work for a company that's unrelated to whatever they were doing before, like especially in the wheelchair repair industry. I think about a place that I used to go to, albeit it's in Torrington. So like literally I travel an hour and a half to go get a wheelchair repair, right? And the next thing you know, it's like they're bought out. You know what I mean? I'm like, oh man, they were good. I didn't like having to travel that far for them, but they were great. You know what I mean? But then you see with like all the other things that we've talked about with wheelchair repair, and then like you thin out your service. So now what are you doing? You're going to ask for people to come in to do these things, and people just don't have the ability to do that, which brings us back to with Medicaid. I was reading something from an article in American Progress, and they were noting that in 2023, the U.S. spent an estimated $1 trillion on Medicare and $871.7 billion on Medicaid. And it's reported that the federal government budget resolution is looking at slashing funding in the amount of $880 billion through from now until 2034. So when you think about that, right, if Medicaid alone is 871.7 billion and you want to slash 880 billion dollars, you're going to be cutting from a lot of programs, but the program that costs the most is Medicaid and Medicare. So you're going to have to make slashes in there. And it goes back to if you're slashing people at CMS, if you're slashing people at the Department of Health and Human Services, if you're doing anything that's going to impede on the process in which people apply, if you're doing anything that's going to limit expansion, if you're going to turn it, instead of being just federally funded, you turn it over to the states and you just give block grants, hospitals are by default, I think, going to have to rescind some of the people that they take on because they want to be reimbursed at the end of the day. And we talked about this privately. Insurance companies, if you're not paying, they'll let you go. That's it. They need their money because it's a risk pool. They have a pool of money that they have to divvy out, and if you're not paying, you know what I mean. So I think that's troublesome as far as the Medicaid possible cuts that could lead there. They also did a study using those numbers that would affect on average $2 billion in federal funding over 9 years to each congressional district, and it would be even more for places like California and Kentucky, where there is a larger population that actually uses Medicaid. So
Hmm.
it's serious business. It's very serious business.
Yeah, and I mean, I've also heard, I don't have the exact numbers in front of me, but the amount of purported fraud and abuse that has been enumerated is something around, it's less than like 100 billion,
Right.
something like 50 or 80 billion. So if that's what the issue is, but there's a resolution to cut basically a year's worth of Medicaid funding, 880 billion. There's no way that you can do that and just claim to be making the system more efficient by cutting unnecessary staff. That is going to end up resulting in cutting actual programs. And the way that these cuts um, might possibly work is instead of reimbursing, on an individual kind of line item basis, reducing the amount that states get in the form of
Mhm.
like a block grant that they can then spend on those programs. So the federal government doesn't necessarily say no, you have to reduce Medicaid funding, but they reduce their level of assistance, forcing states to have to reduce funding for their Medicaid programs. States like Connecticut, which have some pretty, we have a pretty robust emergency fund, rainy day fund, some savings.
Yeah.
Um, our programs might be in better shape than other states that don't have that kind of savings in the bank, um, and can really put a lot of people in trouble.
Yeah. And then even when you have a reserve like that, it's like until when, right? It took having to govern and budget a certain way over a certain period of time in order to have those type of residuals. From that point on, you you want states to continue to be empowered and hopefully you know follow another state's example on how they balance their budget. But then when you make that happen, then where are they going to turn? Is it the government, federal government? Are they going to say, well, sorry, we gave you this amount of money, can't give you any more because what are we doing? And I think that if we're really about representing our constituency, I don't think it should just be limited to what one state is doing versus the next. It needs to be representative that all of us need it, right? Instead of making it so complex and divvying it up, we really need to just have that plain understanding. We are all in need of health coverage, no matter what state you're in. Um, and the federal government, I think, does a good job when they implement these systems. I just don't know about the next administrations or group of legislators that come in who are kind of against it, and then that ends up messing it all up, and then it's a tumble effect. It's not to say you're not supposed to look at programs and see how you can be more efficient with it, but it just strikes a tone of fear in all of us out there who rely on these services.
Absolutely. So, I mean, if you're listening to this and you're on Medicaid, um, know that as advocates and as an organization, we are here to help provide information and education. We're partnered with a great organization called Spinalpedia. that can help you navigate, eligibility and services in your state, especially if you have a disability or a spinal cord injury, with your Medicaid and other benefits. So you can check out spinalpedia.com, register there, and you can get additional information on that. It is a complex system that needs uh, that needs fixing, and unfortunately, or fortunately, I think the disability community has the opportunity to really shine light on that because we rely on it for our survival, for our everyday lives. And if you're not on Medicaid, or if you have the chance to talk to someone who's not on Medicaid and doesn't really understand or appreciate it, just know that people on Medicaid are working. People on Medicaid are giving back to society. We are using it not out of laziness. We are using it out of necessity to survive. And these programs are so important to empower us to make real change in our communities. What is someone with a high level of disability capable of doing? Look at FDR. Look at Christopher Reeve.
Yes.
With all the support he had, was able to launch this foundation, really raise awareness, and use his celebrity status to really bring about change for so many people. So if you believe in that, if you believe in the potential of people with disabilities to make change, then you absolutely need to believe in the promise that programs like Medicaid and other safety net programs have, for our society.
Absolutely. But man, it's a great, wholesome discussion as usual.
Yeah, and there's a lot of questions that we still have about the program, and we're kind of raise those with our community discussion next week, and then later in the month we'll bring back some experts to kind of dive into their professional view on things, on how things can change and what some current impacts might be on current events, based on current events, and trying to keep everyone informed.
For sure.
All right. Well, thank you, Corey, for a great discussion, and stay tuned in, everyone, and sign up for the More Than Walking newsletter at morethanwalking.com to learn about the topic we will cover next and how you can participate. Also, like, comment, and subscribe to our More Than Walking YouTube channel to watch each podcast, and we'll be dropping new episodes every Monday or Tuesday. Follow us wherever you listen to podcasts. Just search for More Than Walking or Super Adaptables.
Indeed. Until then, remain encouraged, stay hopeful, and above all else,
Keep adapting.